very much for joining us. Could you briefly introduce yourself?
My name is Bilal Abid. I am an academic clinician scientist. I work at a cancer center in Houston currently.
Excellent. And can you give me a little bit of an overview of what you've learned at COA 2025?
It's been an interesting meeting for someone who comes from an academic setting. Primarily, it teaches personally me two things. One is the business aspect of running a practice, what happens behind the scenes in terms of revenue, in terms of business, in terms of moving the wheels. That's something that in our academic setting, we typically don't get to know.
Okay.
We are delivering care, and all of that is taken care of by sort of leadership or people who are designated to do that. The other thing that I had a chance to learn firsthand is how the community providers and community practices perceive academicians, academic medical centers, and the partnership that is really building up lately in delivering the novel therapy and cellular therapy in the interest of our patients.
Okay, excellent. That's really good. And you mentioned, you did a talk earlier today about building infrastructure for cellular therapy in the community setting. Can you tell us a little bit about that and why it's important?
All patients, irrespective of where they live, the zip code they live in, the race and ethnicity they belong to, the type of insurance they carry, they deserve equal care and particularly access to all novel therapies. Good proportion, if not more, patients are being cared by community infrastructures nationally. If community practices do not deliver cellular therapy platforms, which is the most novel way of treating cancer, then a good proportion of patients will remain at a disadvantage structurally, and that creates access and disparities in care. Now, large majority of oncology community practices, private settings have started to embrace bispecific platforms. Either they've already started to do that, or they're in the process of creating an infrastructure of doing that. Next step is to move towards CAR T-cell as well, and then TILs and TCRs across solid tumor indications. While we as an oncology community do that, it's important to remember that we all do this in the interest of our patients.
Yeah.
We create that triangle offense that we typically talk about in basketball. So the office comes together between industrial and pharma partners, our community partners, and academic clinician scientists.
Excellent.
So academic physicians and clinician scientists leverage their expertise, protocols, SOPs to community partners. And then our industrial partners come in for education and other logistical and equipment support and onboarding, REMS program, FAC accreditation, and then we create a very uniform and homogeneous cellular therapy care delivery model for one goal, and that is that all patients deserve same medical care.
Excellent, brilliant. Thank you very much for that. I really appreciate your time.
All right, you're welcome. You're welcome. All right.